Hello guys, my name is Dr. Lee, also known as Dr. Pimple Popper, and I'm here to answer all your acne questions. How young is too young to start over-the-counter acne products? You're too young if you might accidentally decide to eat it instead, or like stick it in your mouth instead of putting it on your face. I think that a lot of kids can start, it's not unusual to see them start some mild over-the-counter acne treatments as young as 8, 9, 10. I mean, that's not super unusual. And usually you're gonna see more of a smattering of blackheads and whiteheads. And so, yeah, you can be very gentle with that. You don't have to use a lot of different products. Usually just like a retinol or a tretinoin to really help to, minimize that, maybe a little salicylic acid cleanser. But the point is to, there's something good to say about starting early and really getting used to a regimen like that, especially if you're younger. I tend to see people who break out at a younger age maybe potentially getting more severe acne as they get deeper into their teenage years. The point is that really most over-the-counter acne treatments are safe for most kids at any age, as long as you're not eating it, and also as long as it's not really irritating your skin. Certainly if you're concerned or you're not sure if an acne product that's over the counter is working for you, or if you really feel that it is irritating your skin, please seek out the wisdom of a board-certified dermatologist. How do you know to seek a medical professional for your treatment options instead of just seeking over-the-counter products? Well, I think a good recommendation is to, if you feel like your acne is really severe and you want something done, I think it doesn't hurt to make an appointment with a board-certified dermatologist. Sometimes it can take some months before you actually are able to get in and see the doctor. So in the meantime, use an over-the-counter acne medication and see whether that can help you, and it might even improve your skin, or actually might even get rid of the condition before you even it's even time to see your doctor. The other important thing that I want to stress about acne is it doesn't threaten your life, it doesn't kill us, but obviously it has a potential, if it is severe, to leave you with permanent scars. So that's really when, if you have pretty severe acne, I would be more likely to recommend, hey, make an appointment with a doctor. Maybe you can't see that dermatologist right away. You can start with over-the-counter acne products. That's not going to mess up whatever he or she might prescribe to you later, because that's going to get you going in the right direction. But if you have severe acne, really try to be more aggressive with seeking out more aggressive treatment, because you don't want to be left with lifelong scars. How long should you use over-the-counter products before you seek prescription options? Well, we as dermatologists, usually when we prescribe medications to patients for acne, one of the big things that we are concerned about is compliance, really using these products. Sometimes we might prescribe 3 different things for people to use on their skin. And a lot of the times they can be a little bit sort of shocking in the beginning, because they can really change your skin or make you feel really dry, or sometimes they might even make you break out a little initially in the beginning. So we really try to reassure people to stick with it for 30 days, 60 days, even 90 days. And really sometimes it can take that long for you to really see a change and improvement. And sometimes it gets a little worse before it gets better. And I would say the same thing with over-the-counter products. And again, use your judgment. If you feel like you have pretty bad acne, that you're really anxious about it and you want to get something aggressively treated, make an appointment with a dermatologist. You may likely not be able to get in right away. Use those over-the-counter products. Stick with them for 30, 60, 90 days even, and you should start seeing some sort of improvement. But it's not something that you can just apply for a week and say, oh, my acne's all better. That almost never happens. What do I recommend if the Acne System is drying out your skin? As I would recommend to my patients that I see in the office, if a product, especially the retinol, would probably have a chance of drying out your skin. usually back off on it. Don't use it every day, especially in the beginning. Oftentimes we have to adjust to these products, so it's not unusual for me, especially if I know somebody is not really oily. I'll say start off slow, start off maybe once every other day or every third day until you sort of adjust to it, and then you can slowly, eventually over time, probably be able to use it every day. Also, if you're not sure what product is drying you out, sometimes it's nice to just stop everything and start with one product first. And then as you know, like after 1 week or so, if you're doing just great, then add the next product. So that's not a bad thing to do, certainly, to be able to slowly add things. Some people are allergic to or irritated by benzoyl peroxide. So if you find that that is particularly irritating, you might want to do an alternative like sulfur. Sulfur products are really great and more gentle to your skin, but kind of have the same means of treatment for your acne. Moisturization is also really key. A lot of people who have acne may feel they don't need moisturizer because they are really oily, but also know that a lot of these acne products can dry your skin. It kind of changes your skin landscape, so to speak. So it's really great to add a moisturizer to help keep that moisture in your skin and help to clear your acne at the same time.